Yes, how can I help you today? Oh, of course. Yes, I can meet with you right now if that's okay. Do you have some time? Okay. It shouldn't be such a long meeting. You're a walk-in, so we try to accommodate as best as we can. You came at the right time. Yes. Yes, our clinic specializes in loss of taste and smell. In particular, we try to help you regain your sense of smell so that you may once again have your taste, but it does depend on your condition and, a bit more to it than that. So we'll do our absolute best, but you have come to the right place. Yeah, okay, please take a seat. Yes, get comfortable. Do you need anything like water or tea? Okay. No, I understand. Okay, well, we usually have an intake questionnaire that we usually do with our patients. So I do want to preface, you should be meeting with your primary doctor to get any additional support you might need and any other recommendations to any specialists, okay? Yes, I'll do my very best today to help you. But if there's anything further you might be looking for in terms of input, I recommend referring to your doctor, of course. Absolutely. Okay. Yes, let's go ahead and get started with some of the basic info, okay? Let me just go ahead and pull up a form. Okay. All right, so can you go ahead and give me your name, first and last name? Okay. Great. And your age or birth date? Okay. All right. And then can you provide your primary contact information? Yes, so your email and phone number. We may request your address if you wish for us to send you anything. Okay. So yes, your email then. Okay, and that's at gmail.com. Okay. And then your phone number. Okay. Yes, you can go ahead and provide your address for me. Mm-hmm. Okay, yeah. All right, so we've got your basic contact info. All right, so can you go ahead and tell me, when did you first notice the loss of your sense of smell and or taste? Was it a few days ago, a week ago, several weeks ago, a month or more ago? Okay. So a few weeks. I understand that can be very stressful and it just can be a difficult time. So we completely understand and we're here to support you. So can you describe what you're experiencing a loss of? Is it smell, taste, or is it both smell and taste? Okay. So some of the smell has come back. Okay. Okay, so is the loss of smell or taste complete or partial then? It sounds like smell is partial. Okay, you would describe it as about 70%. Okay, and what about taste? Okay, more like 60. Feels like it's kind of dragging a bit behind. Okay, that makes sense. Yes, no, we deal with this all the time, so we are no strangers to your symptoms or, these types of descriptions of what you're experiencing. It's really quite common. All right, can you provide me any other symptoms that you have been experiencing? So, did you experience fever, cough, shortness of breath, fatigue, sore throat, headache, congestion, or runny nose? Okay, so you were sick and you had a fever. Cough was small. Okay. Fatigue. Okay. Not shortness of breath. Okay. Yes, it can be quite difficult to know whether or not you have shortness of breath or if you're just feeling all the other symptoms more acutely. Okay. Minor sore throat. More itchy. Okay. Headache. Likely a result of the fever, I imagine. Okay, and some congestion. Yes, I can tell you sound a little bit congested. Not quite, but you'll be surprised. I can kind of tell at this point if someone has a bit of congestion. And that can really impact our sense of taste and smell, maybe more than we realize. Okay, so have you recently had any of the following? A cold or flu, sinus infection, allergies, COVID-19, or a head injury? Okay, so it was COVID. Okay. And that will likely explain the culprit of this loss of taste and smell. It's quite common, so in that sense, you're not alone. And this is quite a common symptom. It does vary from person to person, although majority of people do tend to get it back completely, if not partially, very soon after. However, yes, it can take some time, but that is what our clinic is for, is to help you regain it and strengthen your sense of smell again. And of course, thereafter, the taste. All right, do you smoke or use tobacco products? No, okay. Have you been exposed to any chemicals or strong odors recently? No, okay. Do you have any known allergies? None. Are you currently taking any medications? Okay. Okay. Yes, we may want to make sure you consult with your doctors and primary physicians that have prescribed you those, just to make sure that they're not kind of extending the symptom, although I'm almost sure that they probably aren't impacting them. Yes. Do you have any chronic conditions such as any diabetes, neurological disorders, etc.? Okay, thank you. All right, so moving along, how has the loss of smell, taste affected your daily life and activities? Would you say it's had a minimal impact, a moderate impact, or a severe impact? Okay, moderate. Can you describe to me how that's impacted moderate? Has it affected your appetite or enjoyment of food? Okay. You find it hard to eat, I understand. you're only in the mood for, okay, liquids or fast food. Yes, well, that can obviously, any nutrients are going to be important. Of course, staying hydrated, but having more well-rounded, nutrient-dense food is going to be way more helpful just for your bodily function and the healing after you get sick. It's very important that you continue to invite foods that will help you in the long run, and you can have them beside the foods that help you feel, a little bit more comforted, right? So, having a hamburger from a fast food restaurant is totally fine. Perhaps you pair it with some veggies or fruits, things that can really help add to your plate those nutrients your body is looking for. We do actually have a reference for a nutritionist if you would like to meet with one, to get any further input. Yeah. Is there any other impact? Yes, that is right. You cannot smell the more dangerous things such as smoke or gas. That can be a little bit difficult and much more risky, right? Going through our lives without being able to smell more dangerous smells or smells that let us know something is wrong can impact us, make us a little bit more vulnerable. Okay, so it comes in and out. You say, all right. Yeah. Okay. Well, just in case and as a precaution, please make sure your smoke detector is alive and well and, has the latest batteries put in, as that's going to help you make sure you're safe and protected. And if you live with someone, be sure to let them know as well, to just be on the lookout and watching your back in a sense. Alright, have you ever experienced a loss of smell or taste before, maybe with getting ill previously? No. Okay, so this is your first time. Yes, it is likely in the past with maybe the common cold or flu. If you've been very congested, you will not be able to smell or taste for maybe like a day or two, but it's really because of all that congestion. Whereas it sounds like with your congestion wasn't as severe, right? And then it was continuing after that went away. Okay. Absolutely. Right. We are at our last question. Is there anything else you would like to share about your symptoms or concerns? We definitely want to make sure we're keeping everything in mind. Okay. Can you describe that a bit more for me? You're saying you can smell some things in and out. It's not very consistent. And it's just certain smells. Okay. Yes, this will be important for our next section that I plan to go over with you. Okay. That's interesting. Yes. Yeah, we do find the more subtle flavors, the more the vanilla of it all, if you will, is far more difficult to fully taste. Even in regular, when your senses are regularly there, sometimes it can be very difficult to even tell if something has vanilla in it. But when you're dealing with loss of smell and taste, it becomes much more subdued and much more difficult to sort of navigate between all these other scents or flavors going on. yes, it's no surprise that spicier things or smokier things, maybe even more citrusy things, the more potent those flavors are, the more that they even come through. Exactly. So you mentioned peanut butter was sort of more potent. It's likely because of the smokiness of the peanut and the saltiness. Yes, this is all making sense and very interesting. How our different sort of senses come through, our different flavors sort of pick up between each of us, and everyone can kind of have a different experience. But yes, feel free to add as many spices or flavors you love to your food to help enhance it. A lot of fruit can help, lemonade, citrusy things, spicy, foods, or you can focus on textures, right, that are comforting. Everyone's a little bit different, but it depends on what you find comforting, of course. So maybe pastas, cheese, vegetables can be quite difficult, right? Because we're not always over seasoning our vegetables. They're a little bit more on the bland side depending on how you're preparing them. But I'd encourage you to try things out and try to incorporate the vegetables within your meals as much as possible, even if you're hiding them. Right? Hiding them in pasta sauce or, other types of things. Okay, well, that was our questionnaire. Thank you so much for going through that with me. I will go ahead and go to the back just for 5 minutes. I'm going to grab some of our smell training kits and we will go through those together. And you can walk out with those kits and start using them right away to hopefully bring back your sense of smell and, of course, taste. So I'll be right back and we'll go through the kits together. Alright, I brought out 2 of our kits here for smell training, and we can go through each of them, and I can have you test them out today, and I'll go ahead and write a few notes of what you're experiencing, and you can take that with you. You can take the kits with you, and you will be able to test this out over the next few weeks, and we'll set up another appointment in the near future to see our results and see if we need more kits or more testing to kind of go from there. Okay. So we have the smell training kit by Moxie, and we have our basic, or I'd like to say the starter kit for smell training. This is the essentials for getting started, and it includes the key scents of clove, lemon, eucalyptus, and rose. Okay. Then we do have another smell training kit, and I like to call this sort of essentials part 2. And this one is going to have additional scents, and this has cinnamon, grapefruit, peppermint, and lavender. Okay, so I'm going to go through the first one and then we'll do the second. Okay, so Moxie smell training kits are meant to promote and restore your sense of smell. So it includes 4 essential oil nasal inhalers. So they're not just pure essential oils, although that is something you could get, but we find this is easy for you to travel with. It's easy to carry without kind of the sort of the mess of essential oils, unless you were to use essential oils routinely. But we find many people find this very helpful and easy to kind of take with them or store easily. We also include some smell training guides in this kit, and along the side here it says, get to know your sense of smell again. each kit comes with the scents in this box, and of course a few of the instructions. And I'll go ahead and read these with you, okay? Oh, can you pick up some of the scents? Yes, it's very strong. Okay, wonderful. So we'll read this in just a moment. But here are the scents. And you'll see we have clove, we have lemon, eucalyptus, and rose. Okay. So just set that there. So it comes with 2 quick how-to guides. And of course a much more intense guide. It's not too, I find it to be pretty comprehensive, and it's not too much, but we'll go through it together. Alright, so it says your olfactory smell system is able to regenerate after damage. So you can often retrain your brain to smell, similar to how the body rebuilds muscle after an injury. Isn't that great? Scientists and doctors recommend these specific essential oils because they classify the 4 main odor categories that stimulate our sense of smell. The first one is floral, which is the rose essential oil. The next one is fruity, which is lemon essential oil. The next one is resinous, which is eucalyptus essential oil. And spice, which is the clove essential oil. Okay, and it even shows you as well. Okay, alright. So, what is smell training? Your olfactory smell system is unique in that it can regenerate its neural pathways throughout your lifetime, unlike most of your other senses. With smell training, this means that the connections between your nose and your brain that help you identify scents can regrow after injury or damage. Thanks to the close neurological link between smell and memory, you can actually teach your brain how to smell again by experiencing different aromas and recalling memories of your experience with each of them. It's fascinating how our memories truly impact our sense of taste and smell much more than we realize. This will play a key part in the smell training kit. Okay, some reminders. Add comments of each scent describing your perception of it. Does rose actually smell sweet floral as it should, or is it unrecognizable as rose? Try to acknowledge the differences and record the information. And there is a little log on the bag where you can record sort of the strength, and it's between 0, cannot smell anything, 5, smells as it should. So if you rate it from 0 to 5, that allows you to identify the strength of that scent over time. However, if you'd like to keep a more descriptive journal, you can absolutely do that in a notebook or on your phone app. You can, on your notes app, write down kind of the different scents and if, they're changing over time. Smell with intention. Really focus and concentrate on memories of your experience with that specific scent as you smell each inhaler. These specific oils are recommended by scientists and doctors for smell training because they classify the 4 main odor categories that stimulate our sense of smell. You'll get the best results by being consistent and practicing these steps every day. So yes, it is quite a habit you're going to have to sort of have for a little bit. I recommend finding a time in your day where it's going to make the most sense for you. If that means you have to bring them along, it's going to be easily compact for you to do that. Or you could do it in the morning or at night. Okay. So the aromatic qualities of odor categories are listed here with their little icons, but I'll go ahead and read each one. So fruity is the sweet, vibrant, fresh, citrus, berries, strawberries, those types of items. Spicy is going to be warm, sharp, tingly. For example, cinnamon, ginger, nutmeg. Resinous is going to be piney, woodsy, leathery, cooling. So think of balsam fir, cedar, and pine. Floral is going to be subtly sweet, soft. For example, jasmine, lavender, and fresh rose. So you can tell from those descriptions just a little bit more can help you sort of think to the examples in life you've had previously, right? So you have the opportunity to recall things and how they used to smell or taste. And that's actually a very good thing to have because it can help you retrain again to recognize them again. So this quick how-to guide here, you're going to want to find a calm and relaxing area where you can focus. Twist open an inhaler of your choice and place near your nostrils. You will then inhale through your nose gently and freely for 20 to 30 seconds. You can use a timer if that helps you. While doing this, smell with intention and really do your best to concentrate on memories of your experience with that scent. With lemon, for example, recall slicing lemons or the tang of a cup of water with lemon. Diligence is key here. Rewiring neural connections in your brain is no small task, and this will take time. Do this twice daily with all 4 inhalers for a minimum of 12 to 16 weeks. Record your results in the smell log, which is back here. The goal is to rate the strength of each scent of the inhaler each time you smell it. This will help track your smell training results over time. So you're going to need a few peaceful moments in the day and a quiet space free of distractions or other strong odors. You may wish to track your progress with a log recording daily or weekly changes in scent perception. When you start, maybe you can't smell the essential oil at all. Over time, you might begin to smell a faint hint of that scent. It helps to acknowledge scent cues and whether or not they align with your memory of the scent. So you can tell how memory is going to play a key part in this, right? Alright, so you will be able to keep this. Okay. And then these are just sort of a summarization of the steps we just went over, if you ever need to refer to them again. Okay. So, I'm going to go ahead and test this set out with you as well as the next set. So we're gonna just start off with these, and I would like for you to smell each one and describe to me the scents and memories you're having. Okay, if at all, if it's very difficult, that's okay. This is going to be a practice you do over time. I'm simply doing this to help you establish that practice and make sure that you can do this on your own, and when we meet again, we can discuss the results. Yes, okay. So let's start off with clove. Now you're going to just go ahead and twist it, and you'll see some holes at the bottom here. And there's also one at the top. So I would like for you to go ahead and try this out. Just open it up under your nose like so. Sniff for about 20 seconds and let me know what you're smelling. Okay, here you go. Okay, alright, so describe to me the scents or memories. Okay, you can kind of smell, alright. How would you say percentage wise or rate from 0 to 5? 4. Okay, that's good. Okay, it reminds you of firewood, pine cones. Oh, the cinnamon ones from Michael's. That's so specific. So like the holiday cinnamon. Okay, so the holidays reminds you of the holidays. That's a lovely thought. Okay, anything else? Wet earth, baked goods. That's a good one. All right, is there anything else? It mainly reminds you of winter and fall. Okay, that's good. I'm glad it's coming out strongly for you. It seems like that one is probably coming through pretty well. Okay. Alright, yeah. Thank you. Okay, I'll go ahead and put this one back. Now, let's go ahead and try lemon. Again, you want to open it up. And you can place it here, or you can smell it here, whatever is strongest to you. Okay. Here you go. Alright, now what can you tell me about lemon? A 2, okay. Sort of like the faintest tingle of a lemon. That's interesting. So you can kind of taste the sourness. You know, obviously you're not tasting this, but it reminds you of the taste of sourness. Okay. Oh, okay, yeah, lemon might have been one of the first signs where you were like, you can taste it very well. Okay. Okay. And fruit, so you have a hard time eating fruit. Okay. You can't taste strawberries. Alright. Or nectarines or peaches. Okay. Alright. Okay, no problem. You did your best. You know, this is a good sign that something is there and it can be worked on, right? Okay. No problem. Yeah. Okay. Thank you. Go ahead and put that one back. Now let's go ahead and do eucalyptus. And this one I feel is pretty pungent for some reason. Okay, here you go. Now, what can you tell me about resinous or eucalyptus? Okay. Okay, you would say it's about a 3. Okay, it smells medicinal. Sort of like medicine. Okay. Alright, that's fair. So less of the like calming of the eucalyptus and more of the like spice of it, if you will. Yeah. The more kind of, yeah, absolutely. Okay, that chapstick. Okay, reminds you of that. Cough medicine. That's fair. Anything else? Okay. Yeah. Yeah. Okay. Thank you. Alright, well, well, this one sounded like it was pungent, but a little on the average for, what you are remembering eucalyptus to smell like. All right, and the last one is rose. Okay, this one. Okay, all right, so here you go. Okay, now what can you tell me about rose or floral? It's about a 3. Okay. Wet flowers. Okay. Okay, it's strong. That's good. But it's almost not well rounded. I understand. Not as sweet. I get that. Herbally, okay. More grass scent. Okay. Alright. Yeah, this is all good, and it's going to absolutely help in the progress that is going to continue to come, and this is the exercise we hope that you continue on in your own day-to-day. Yeah. Okay. Thank you. Alright, so that was rose. I will go ahead and place the guide back in. And okay, we went through the first training kit, and now we can move on to the second one. Now you're going to want to master the scents in the first kit, ideally first. However, you can smell these in addition. Just, remember it takes time, and you can pace yourself with the different scents. Okay, so again, this one has lavender, peppermint, grapefruit, and cinnamon. Okay, set that aside. And again, you have the same instructions, and you have new scents here. Okay, so we have the same, instructions here. So it does say that phase 1 is the white box. It's recommended to use that one for the traditional scents of lemon, rose, eucalyptus, and clove. Phase 2, research shows that adapting training to incorporate similar aromas helps to cement the odor categories fruity, floral, resinous, and spicy in your brain and expand the scents you're able to recognize and differentiate from. So this scent diversification makes recognition easier and reinforces your smell system regeneration. Where you may have once perceived rose as only vaguely floral, the Phase 2 smelling training kit will not only help you recognize its odor category, but will help you to name it as rose and differentiate it from lavender, another floral scent. You should begin Phase 2 immediately after completing the Phase 1 smell training kit. Okay, and then it has the log as well, and basically the same instructions, but I'll leave this for you. So this is our Phase 2 kit. Alright, so I'll go ahead and get a new sheet here. And we'll simply go through this together. Of course, you're going to want to do this after Phase 1, but for today's demonstration, we'll go ahead and help you identify these today as well, okay? So let's start off with grapefruit. Start from the middle here. Grapefruit. It's our citrus, similar to the lemon. here you go. Alright. Now, what can you tell me about that? Okay, a 2 or 3, and why is that? It smells almost exactly like the lemon. You can't tell them apart. Okay. That makes sense. So tangy, can't really differentiate. Okay, no problem. Alright. Thank you. Okay, put this one back. Let's go ahead and do peppermint. So very similar to eucalyptus. Okay, here you go. Alright, now, what can you tell me about peppermint? Ooh, a 4. Smells like toothpaste. Okay, that's a good sign. Mouthwash. Candy cane. Alright, so it sounds like it's sort of strong. Okay, but not as full-bodied as you felt. Okay. And it's hard for you to kind of smell your toothpaste now, right? Okay. It could be that you use your toothpaste every day. It has strong peppermint, so you're introducing that scent already quite frequently. So your body is probably catching on a little bit quicker than you think. Yeah. Well, that's good. Okay. Yes, thank you. Alright, put that one back. Let's do lavender next. Okay, for lavender. Here you go. Okay. Alright, what can you tell me about lavender? You gave it a 3. Okay. Similar to rose, more warm. Oh, it reminds you of that, of a candle you had. That's good. It might be that that scent has been around you much more, so it's coming more visibly through than the rose did. Calming. Okay. Oh, okay, so you have a body spray that probably has lavender in it, so it reminds you of that. That's good. Perfumes and body sprays are likely introducing these scents as well. Yeah. Okay. Alright. Not too bad. It seems like you have some sense of smell coming through, but it's just not as strong, and it's probably impacting your taste as well. But you are likely going to see progress over the next few weeks and months, okay? Alright, so we have our last phase 2 scent, cinnamon. Okay, here you go. Okay. Alright, cinnamon, which is our spice scent. What can you tell me about that one? A 3. Okay, so clove was stronger. Barely, like faded. Okay. Kind of reminds you of the holidays, but just like in a more subtle, way. Okay. Yeah, didn't come through as well. That's fair. Okay. Yes. All right. Okay. Thank you. All right. Well, we went through all the scents in our phase 1 and phase 2 kit. So that is our sort of demonstration of these kits and something you can obviously do at home. You can take these home with you today. go ahead and give you these notes so you can take them with you as well. What did you think of our demonstration and the smells of the different scents? Right, it is fascinating how it brings up memories. I would say do your best to hold on to that and continue to practice these, and make sure that you're logging at least the rating from 0 to 5. You may not need to write down descriptions, but it could be even more helpful. So I'll go ahead and give these over to you, and then we can book your next appointment. Okay, let's do that. All right, here you go. Okay, so let's go ahead and book out from, let's say, I would say 2 months. If you want to do earlier, we can book for something earlier, but I think that'll be a good enough amount of time for you to progress and really get some results down, and come back with your updates with us. And if we need to supplement more kits, we can, or we can walk through the results with you and our input. Okay? Alright, so what days of the week do you prefer? Okay, let me see if that Wednesday. We have early around 8 a.m. to 10 a.m. available, of course, between that time, and then we also have after 2 p.m. You want to do 3? Okay, let's do 3 p.m. Okay. Alright, you are all set. Thank you so much for coming in. I'm so happy we got to meet you and help you start out regaining your sense of smell and taste again. It was my pleasure to help you today, and I look forward to seeing you again very soon. Okay, call us if you need anything, okay? Of course. Thank you.